Well, we're back with Dr. Fankhauser. We talked about missing teeth being a problem. Now, Dr. Fankhauser, let's talk a little bit about a few methods on how to replace missing teeth, because I'm sure there's a bunch of options. Some are cheaper, some are more expensive. And when does fit one another? When is one better or not better?
Well, there are several methods. If we really start with replacing a missing tooth with an implant, that's kind of, in today's day and age, it's a more natural way to place a tooth in, because you're not connecting teeth together so much, and it feels more natural. Other ways are with bridges. You might look at a bridge as being a post on one side, post on the other side, and something hanging in the middle. So we put a fake tooth right in the middle, okay? Another way to do it is with removable appliances. You have to take them in and out. They work very well. A little bit harder to get used to. Cost less, though.
Okay. Well, let me ask you, the bridge is probably the one which has been around for a long time. So you need basically, what you do is you have to have two, good teeth at the end, and then you can, in the middle, one or maybe two teeth can be missing, and you put them in between in it, and they hang like a bridge.
Yes.
That's why it's called a bridge. And when that happens, so you really actually, let's just say there's one tooth missing and you need to fix the two. You really have three, what you dentists call a unit, three teeth, three ceramic crowns or caps. Does the price of those three ceramic caps and the whole working, is that still a lot less than having one implant not touching the other teeth around you? Is the price still a tremendous amount of difference?
It's getting a lot closer. It used to be, yes, but with some newer developments, it's getting to be a lot closer in price or cost. But when you do a bridge, if the tooth on each side has never been filled or never been crowned or anything like that, then you have to basically cut down or prepare the outside of teeth that may not need it. Whereas with an implant, you don't affect the teeth on either side of the space.
Right.
So.
Yeah. What about the duration? Like an implant, more or less, how long does it last versus a crown, a bridge? In terms of years, is there information out there, data out there of like that one lasts longer than the other?
Bridges are asked to. A bridge is asking two teeth to do the work of 3 or 4 or sometimes 5. That puts a lot of extra strain on those teeth that are left, and so the failure rate is higher basically with a bridge than it is with an implant. Implants are now probably 95% successful for the long term.
And what's long term? 5 years, 10 years, 20 years? What are we talking about here?
Oh, it could be 20, 25 years. It depends on how, everything depends on how well you take care of it. If you put a lot of biting stress on a tooth or an implant, you may break something. Okay. But if you're careful, things will last a long time.
And what about a bridge? Are we also talking 20, 25 years, or are we talking a lot less?
Oh, I've seen bridges that have lasted 30, 40 years. Not ones that I put in. I haven't been there quite that long, but and I've also seen bridges that only lasted a year. So It's really hard to tell. You have to look at the individual situation.
Of course. But on an average, I've heard that a bridge definitely doesn't last quite as long as an implant, which means if you have to redo it, let's say 10 years later versus an implant 20, and that's of course just an average that might not apply to the individual. So then he already comes out a little less expensive on a long run there in the first place. That's what some people mention. Do you think there's something to it?
Well, yes. If a bridge fails, you need to really stop and ask the patient, do you really want to put in another bridge like the one that failed, or do you want to take and correct the situation, put some implants in that are going to be stronger and basically work better, like real teeth? But putting a bridge in depends on a lot of things. Depends on did they balance the bite correctly? Is the preparations on the teeth such that the bridge will stay fixed on there? See, if it comes off too easy, then it's not going to last very long. So there's a lot of things like that.
All right. Okay. There's also the fact of that when you have a bridge, you have three or more teeth, 4 to 5, put together, and it is very difficult to floss in between, and thus gum disease is a major concern in that area by what most dentists say. Right or wrong?
Well, flossing is not impossible. It's just a little bit more difficult. So
that's what makes it difficult.
Yeah.
We on an average, most of us do a little bit of flossing and all that, but when it becomes difficult, it's just next thing you know, that area doesn't get flossed as often as it should be.
Yeah, because it takes a little bit more effort. But generally with the implants, then you can go and you can floss on either side of it pretty easy. So that's one more advantage.
Good. Well, all right. Well, thanks for telling us about the difference of implants and crowns and bridges and how to replace missing teeth. Thanks a lot, Dr. Fankhauser.
Thank you.